Assalamu alaikum wa rahmatullahi wa barakatuhu, and welcome back to Siraat Al-Ghuraba, Path of the Strangers, the strangest podcast in the world. And alhamdulillah, today I'm joined with my regular co-host, Brother Abdullah. And today we have the honor to be with Brother Musaab, who is a first-year med student. And he'll be joining us in a discussion surrounding the healthcare system in America. And I think there's a lot that can be said. Recently, there was, I'm sure many of you guys actually saw in the news, was it Luigi Mangione, right? He took some matters in his own hands, and actually shot a very prominent healthcare executive. I believe he was one of the chief executives for United Healthcare, which is probably one of the biggest, if bigger, if not the biggest, health insurance companies in America, and that brought a lot of light to this topic of healthcare and health insurance, and how and people started really questioning how things operated. And I'm sure you guys saw the reaction online, be like, people were subhanAllah supporting this daylight murder, right? And obviously we're not taking a position here on like what's correct, what's not correct. Obviously, as Muslims, we can't this vigilantism. It's not something that Islam condones, and that's, I think, a separate topic we started to talk about on the side of how it's actually Western Hollywood and these cartoons, Batman and stuff. These guys are supporting vigilantism, and that's a separate topic. But I brought into light what people started questioning, their how healthcare operates in America, and I wanted that to be our discussion today. How really the system here in America is not serving people's health and people's care and people's lives, and really it's as a summary, we hope to discuss how Islam and the Islamic healthcare system, and if a healthcare model is modeled after Islam, that's when people's lives are really put as a priority. So before we get started, Brother Musab, welcome. How are you doing today?
Good, alhamdulillah. How are you? Jazakallah khairan for inviting me. It's an honor to be
Alhamdulillah.
here on Path of the Strangers podcast, and inshallah, we'll have many more.
Inshallah, inshallah. So
Inshallah.
let's get started with the first question of the day. I'm wondering, I mean, you guys have been in this country for some time, if not all your lives. What's been your experience with healthcare, seeking healthcare, whether it's for family members, whether it's for yourself, and you don't have to go super detailed sometimes. But the Musa, why don't we start with you?
Yeah, I mean, I have both like personal and professional experiences kind of within the healthcare system overall. In personal experiences, you just realize how expensive everything is. Like I've been putting off, a simple root canal for several years now, or sometimes I'll just go back to Jordan because a plane ticket there plus spending 2 weeks there is cheaper than paying for a root canal here. And I'll get all my dental work done there. So like on a personal experience, just as any kind of member within the society, you realize just how expensive simple healthcare costs are. And you understand that, the average American or the average citizen within the US really cannot afford to get sick or to truly get ill. It's something that's very, very risky on their livelihood and on their, near future, and their finances, and on their family's well-being, and so on and so forth. But professionally, kind of working in the ER for a couple of years, interacting a lot with administration, helping implement a couple of programs within several ERs within the Midwest region, I've seen a lot of the corrupt systems that are in place and a lot of the restrictions that are imposed upon healthcare professionals, nursing staff, by hospital administration, by policy administrators, and so on and so forth. The physicians themselves, nurses themselves, are unable to provide the true healthcare that they want and the true compassionate care, well-rounded care for their patients because of these systems and because of the policies that are imposed upon them from the administrators that aren't involved with healthcare at all, have no experience in medicine, really don't interact with the patients and understand the reality of society.
Jazakallah khair, Brother Musab. Abdullah, any comments on this? Any personal experiences with healthcare, anything like that?
Yeah, actually, there was a story where I was on a trip with a bunch of guys, and we went to Michigan, northern Michigan area in the fall time. And I remember we rented ATVs, and we started kind of going really fast with the ATVs. It was kind of raining at the time, and we were kind of dumb, man. I'll be honest, because all of us were sitting in like a 7-seater ATV, and then we were like drifting with the ATV. And I remember one of the guys that was with us, he was driving the ATV. Separately after like this whole thing, we were kind of goofing around, and I was in the car with him, and the ATV fell over, and his foot actually hit the ground as the ATV was hitting the ground. So the force of the ATV fully hit his foot. It was a pretty serious injury. We all picked him up. He was a bigger guy and brought him inside. And we called 911. We didn't know what else to do. And when they came with the ambulance, they said, "Look, we can take you on the ambulance, but it's gonna cost you. Do you want your friends to take you, or do you want to go on the ambulance?" And then he decided, dude, I don't want that bill. I don't want that. I don't know how many thousand or dollar bill that'll be. So we ended up taking him to the hospital, and just having to make that decision while in that excruciating pain. That was one of my first times where I was like, man, we're getting nickel and dimed here, and we're not getting any, we're not getting the quality of service that one would expect in that dire situation.
What
Just
now? I mean, one quick thing. So this is just his ankle, right? You said his foot.
Yeah,
Dude,
yeah, yeah,
imagine if it was
yeah.
something more serious than that. Something like a cardiac arrest or a heart attack or something that's really life threatening. And
Right,
imagine
right,
having to make that decision. I'm alhamdulillah, you guys were there as a friend who could take it, but I mean, you don't always have someone with you. How do
right.
you? I can't even imagine, right?
Yeah,
What's
yeah.
up? You're gonna say
on
something?
that same note, though, I want to kind of like some statistics related to truly how much debt and how much of an economic force it has on the American people and the American society. Some statistics say that 41% of US adults as of 2023 have some sort of medical debt. So you're talking about almost half of the adult population in the US. And then the American Journal of Public Health states that 50% of bankruptcies that are announced in the US are due to some extent, medical expenses linked to medical expenses. So you're saying like 50% of the population is suffering from medical debt. Almost half the people that announce bankruptcy is because of simple medical expenses. I remember watching a video kind of listening to the comparison between, I think, one of the European countries and here, just in terms of birth, whether it's ambulance expenses or anything like that. In terms of birth, the expenses here are so high that it truly is mind boggling with minimal work required. And even they have a fee associated with putting the newborn on the mother's chest. So if like the mother chooses not to put the newborn on her chest as soon as the baby is born, that's kind of a reduced fee. But if she chooses to have the baby on her chest as soon as it's born, which is like the natural thing that mothers want to do and that families want to do, they have a fee associated with that.
Wow, subhanAllah. One thing I was just thinking in my head was I would love to talk to a medical coder, like people who work in the sort of back
Mm.
end of like, so okay, on the provider side, you treat the patient and you type in like a billing code based on how long that visit was or something like that. But on the back end, like there's like each form you fill out, there's like a code for that you can have some sort of reimbursement, and each each little item you provide, as you're saying, you're putting a baby on a mother's chest, a code for billing code for that. I mean, I can't imagine, right? One of the things Mother Musabi said, right, about this, I think the term is medical tourism, and people here in America, especially, they'll go to like South America, I think Mexico, for especially for
Mm.
dental treatment. There's like I think right out across the border in Mexico, there's like a town, I think, associated with specifically dental procedures. I mean, it's like um, the way the system is set up. I mean, the way the incentives are set up, and I mean, it's not like you guys. I'm sure most of you have experience talking with actual real providers, doctors, physician assistants. They themselves are fed up. That's why, if I'm not mistaken, what the burnout rate in healthcare is like at an all-time high. People are quitting. I just had one of my good friends. He said his family doctor like quit on him out of nowhere. He was a young guy, and he just quit on him, and I guess to find a few new like regular doctor. One thing I wanna ask Musab to you specifically is, in your time with you said you worked in an emergency room, has did you ever come across like I'm sure in emergency room you see some pretty serious cases, right? Some life and death scenarios. Was there ever a time or experience you recall where it's like the patient had to make a decision on the spot, similar to what Abdullah described about not going into this ambulance or not, or taking your own ride there? I mean, was there ever any more serious, like life and death scenario where it was really a stressful situation for patients or family members in making a decision on if I should seek treatment here? Any experience like that in the emergency department?
Honestly, tons of it. Over the last couple of years, since COVID, since the pandemic, there's been this tremendous nationwide nursing shortage. And our hospital, I feel like it's been worse than other hospitals. We, in our emergency room, In the 4 years that I've worked there, I have never experienced a shift where every single room in our emergency department is functioning and available because of a nursing shortage staff. And beyond that, in the hospital itself, so the inpatient side, the ICU side, half of the hospital wings are entirely closed, not because the hospital doesn't have the rooms, but because they don't have the staffing associated with putting patients there, enough nursing staff, enough, physicians, enough ICU docs, and so on and so forth. And I remember, several instances, I'd work mainly out in the waiting room, kind of triaging patients along with the nursing staff, getting patients out, trying to get them as quick as possible to get, rapid medical exams with our AP providers and so on and so forth. And we'd have patients walk in, to the waiting room. They're just walking in, a lot of them with more serious complaints, whether it's with like chest pain, shortness of breath, which do have, a higher risk stratification. And they'd come into the emergency room and they'd see an absolutely packed waiting room. Absolutely packed to the brim, no seats available. And they'd ask us, like, how long is the wait time? And we'd tell them, like, we don't want you to leave, but realistically, you might be sitting in this waiting room for 6 to 8 hours. You might not leave this emergency department for another 12, 13 hours. And it's just, you'd see the shock on their face, like, they're actually sick. There's, in our emergency department, we've seen ambulances, because there's no rooms in the back, ambulances bring patients to the waiting room. And then they sit in the waiting room. They can be elderly in the wheelchairs. I've had moments where, like, they're just slouched down. There's, 2 real instances that are eye openers. One of them was, there was a patient that came in, and I was like there around midnight, 1 a.m. And the patient came into the waiting room, chest pain. So we do our basic screening exams, EKG, kind of stuff like that. And they ended up dying in the waiting room. They had a pulmonary embolism. They had cardiac arrest. They're out in the waiting room amongst a plethora of people. You've had heart attacks that an EKG could set to a doc in the back, and he's like, that patient has a heart, is having a STEMI right now. We have to take them back. I've come on to like 6 a.m. or 7 a.m. shifts. I'm working the morning shift, and I'll come out to the waiting room to start my shift. I like to start out running, try to get as much done as possible. And there's patients that their chart hasn't been inputted to the computer, or they even haven't had their basic lab draws, basic EKG, just basic triage tests done, and they arrived at 2 a.m. So they've been there for 5-6 hours in the waiting room, not even waiting for results. They just haven't been seen at all, period. They've just been registered on the computer and barely had their vital signs done. That is truly the impact that you see, like, at a frontline level in the emergency department, on patients, on their livelihood, on their safety.
Is that a 1 second, Abdullah, is that a problem on, is that specifically a provider / staff shortage problem, or is there something more? Is there something behind that, like billing reasons or insurance reasons? What's the holdup in seeing patients and when they're in the waiting room?
A big part of that is finances. Like, I've attended so many department meetings with my medical director, just as like leading my team, but mostly I just listen in just to see the conversations that occur. And so many physicians, and especially our advanced practitioner providers, our APPs, because they're the ones out in triage and out in the, kind of the waiting room that see those lower acuity patients. And they complain to nursing, the head of the nursing department, to hospital administration, saying it is genuinely not safe. I am afraid to practice medicine here because I feel that I cannot provide the safety for my patients. There's not enough. Like, you have a patient sitting in one of our mini waiting rooms waiting to be admitted that has a acute kidney injury with renal failure or a pulmonary embolism, things that shouldn't be out in the triage area, but they're sitting in the triage area. And it's mainly because the hospital, they ask, like, why isn't the hospital hiring more nurses? Finances. They want to find the best offer. They don't want to pay as much for nursing staff. Nurses go on strike every month and the next because they're not getting paid enough. They're not getting the proper accommodations. They're not getting the proper benefits. And it's just a continuous cycle from administration caring more about the money and looking at healthcare as a profitable business, as opposed to a means of helping society and helping the people. And related to that, I have like a statistic kind of related to that, which is 72% of U.S. hospitals are considered private, meaning that they're mainly prioritizing revenue over their care. And simultaneously, there's kind of the statistic that came out over the past decade for U.S. healthcare CEOs. And it said that over the past decade, they've earned over a combined $4.5 billion profiting off of just healthcare, where there's millions of people struggling with basic care. 4.5 billion.
Oh, 4.5 billion.
Yeah,
Still,
and
it's
that's just
insane.
the top healthcare CEOs. We're not talking about overall, just the top healthcare CEOs. They earned a combined 4.5 billion just in the past in the past decade.
This reminds me of going back to Luigi Mangione. He actually had a manifesto, and he wrote in the manifesto that the U.S. has the number one most expensive healthcare system, but they rank 42 in life expectancy. And I think that the way you're describing it is it could be a lot higher in life expectancy if that level of greed, that level of not staffing people just to line your pockets wasn't there. And that's what we saw on that day when the CEO was targeted. We saw that outrage. And I know I'm kind of going on a tangent here, but if you think about it, Luigi wasn't someone that he describes how his mother went through that system, and it's not like he didn't come from a well-off family, right? He came from a family who was doing well within the system. And the reason why I think he was one that maybe flipped the script and maybe did that attack, which was very precise. I mean, even the cops were saying it was so precise, was because he had the bandwidth to actually think about the corruption of the system, but he didn't necessarily have the solution. So he did what he could within his sphere of control. Um, yeah, I just
Abdullah,
want.
what do you mean by thinking about the solution? Why wouldn't someone else have the bandwidth to think about the solution, or
I mean,
think about doing something? Yeah.
brother Musaab Farouk was mentioning, like 50% of people have so much healthcare debt in the U.S. Right? If you're constantly worried about bills, you're worried about providing, that bill is probably gonna be on your record for a long time. You're not really gonna be paying it. You're not gonna be focusing on it. You're just trying to survive, right? It takes, I think, a certain amount um, of intellect. It takes a certain amount of free time. Not saying they don't have intellect. I'm saying it takes a certain amount of free time to even think about what is the root issue here, and hopefully we can shed some light on that during
Yeah.
this podcast.
Yeah. Inshallah. So a couple questions come to mind. Is number one, do you blame? I mean, Musab, you can shed some light on this. I mean, do you blame someone like what Luigi Mangione did? I mean, yes, okay, you have a blame, but did you not expect something like this to occur? Like that's the thought that comes to my head. And then number two is like, um, you hear, I'm sure you guys, I get these YouTube video recommendations of like, I quit my tenure. Was that one doctor? It was a neurosurgeon. I was an MIT
Yep.
surgeon, and I
Hmm.
Yeah.
quit. I'm
Yeah,
sure
I
that
saw
was a
that
one
too. Yeah,
viral
yeah.
video, right? Yeah, he
Juby is
he
his
was
name or
15
whatever. Yeah.
year yeah, something like that. And he quit his job. He's like, no, I couldn't do this the way I was trained and the system, and it was like I couldn't take it. And you see, I saw there was one resident, I think it was in Philadelphia. He was like, I was in first year residency, I quit. I was like, I can't do this. I mean, do you blame these guys for doing that? I mean, I'm sure. Musa, maybe you might know someone personally in your school that might have quit, or in your work that left their job. What's your reaction to this?
With regards to kind of Luigi Mangione, I mean, like the first, thought, obviously we have to look at it in an Islamic lens. In an Islamic lens, there's our morals come from the Quran, the Sunnah, from what Allah subhanahu wa ta'ala provided as halal and haram. And so we can never justify kind of the murder, the killing in any way, shape, or form, kind of in this scenario. But in kind of just understanding the reality and the lay of the land, understanding what's going on with healthcare and the pressure it's providing on people, both in a health standpoint, in an economic standpoint, in a social standpoint, it's really pressuring people and pushing them to the corner that no matter what, they're just going to reach their boiling point. People are going to get to their breaking point, and that will appear in any way, whether it's in protests or in situations like Luigi Mangione. So it's something that should be expected. And honestly, I'm surprised that it even took this long for an event like that to occur. We've seen, people explode over various other things and various other pressures, whether it's socially or ethnically or any, other related scenarios. But in this situation, the healthcare system truly is a tyrant. It's a parasite. It's a leech, sucking the blood out of the people that they really can't escape it. And at some point, they're going to say enough is enough. Even if they're American, even if they support the capitalist system, even if they support the U.S. overall, when it pressures them to that extent, they truly cannot, a human being cannot live with and accept that. On the other hand, kind of with the experience on physicians and on the healthcare side, I mean, I work with one of the ER physicians. He's a really great guy, and he's been working in the ER for like 35 years. The guy's like 65 years old. So he's really kind of on his breaking point in general. He just wants to retire. He's kind of over everything. And he just tells me how much healthcare has changed. He's like, early on in my days, it was about treating the patient. It was about me taking care of the patient, making sure I provide them with all the procedures necessary, the medications necessary, trying to connect them with the outpatient resources, the specialist resources, and just helping them at the moment. Because ER really isn't about the long term, it's about helping them at that moment and connecting them with the appropriate resources. And he's like, now it's just a straight up bureaucracy that he's sick of it. He can't see patients the way he wants to. Every day in the next, and like I feel bad, every day in the next, you have a new policy set down by like the medical director or hospital administration on, oh, your charts weren't good enough. And I was managing that for a while. I was sending all of our docs, all of our APPs, I was sending them an email twice a week if they had outstanding charts or if they had charts that didn't have a correct critical care note or a correct sepsis note or a correct, oh, you talked to this provider at this time or a time step or your physical exam was a little off. I was the person kind of that was connecting what you talked about, the medical coders in the background and the physicians at the front line. And I felt bad because I was harassing them every day in the next and emailing them that, even though I knew it was like my job and like they knew it was my job. But it got to the point where medicine isn't about treating the patient anymore. Healthcare isn't about taking care of the patient. Emergency medicine isn't about taking care of emergencies. It's about trying to kind of please the upper administrators and please the policies. I look at statistics right now with a lot of the programs that I'm managing in a couple of emergency departments. And one of the things I hate the most is in our meetings, they'll say, oh, why are your hospital's critical care capture rates so low? Like, what are your programs doing wrong? And that's like coming from RCM, from the billing system that's kind of managing.
Can you go over what that
Yeah,
means?
yeah. Can you? I'm
So
a little
it's
confused. Can you explain what that means?
yeah, so critical care is just a specific thing in documentation. If a patient's like critical, they have specific criteria, they meet those criteria, you have to put a statement in there saying that you worked and did critical care time for like 35 to 75 minutes or 75 to 120 minutes, and that brings them to a higher billing level, a higher billing code. And so in order to profit off that, in order to get that from insurance and so on and so forth. And so our company is like, hey,
Wow.
why are you guys not getting critical care rates? Like, what's going on here?
Mhm.
And like now we have to harass the docs and tell them, hey, you guys got to start putting more critical care in. But in the end, the patient is suffering because they have to pay more or their insurance is paying more. And it's just an endless cycle. It's a cycle of, oh, you have to chart the way they want us to. You have to put specific buzzwords that they want to. And that's what they teach us as scribes. You have to put specific buzzwords that the coders, which are not medical professionals, that the insurance agents, which are not medical professionals, can see that and be like, oh, I approve of that, or oh, I don't approve of that.
Yeah, yeah. Real quickly, I was just thinking, at first when he said, okay, you have to send these emails out to the providers, be like, hey, you need to do this, put this in the chart, or close this note, whatever. At first, I was like, okay, no, that's a good thing. Charting and making proper notes and making complete notes. That's a part of a good healthcare. It's part of good healthcare, right? Because then if you in the future, then you want to go refer back to a note, see what the history is. That's all. That's all good. But then as you start expanding on that, like the reason for that isn't good care. The reason for that is, I can bill it more. I can bill it more and make more money. So it's at the end of the day, everything is sort of, you know, what's going to bring me more profit. That's the policies I'm gonna input. That's the protocol I'm gonna send down. I'm gonna harass my doctors, as you're saying, harass the workers there, and make sure to do the job that I can then make most money off of my hospital system that I set up. So that's unfortunate. Abdullah, I
I,
think you were
I
gonna
have
say
two
something,
questions.
correct?
I have two questions for you guys. Since you guys are both have been around the healthcare system a little bit, working within that field. So the number one is, how much um, power do the doctors have within the system? Let's say the doctor is very senior, and he knows that his patient is financially not doing well. Can he, for example, signal to the insurance company that, okay, cover this, like let me put some pressure on the insurance companies to cover it? And number two, my question is, if you are a doctor and you don't want to work with inside this hospital administration system, why not just open up a private clinic and charge pretty fair rates, and focus on helping the people? Like, isn't that an option that some doctors can take?
Do you want to go
On
first,
the
Khalifa?
so on the second note, I'll say is I know some doctors who will volunteer in these community free clinics, and I guess that's a way to, you know, I guess quote unquote give back, or get away from the bureaucracy, as you said, right, as Musab said. But I think, even, I mean, I could be wrong, Musab, you might have more knowledge on this, but even if you have a private clinic set up, the way you charge for your care is still to insurance. And I think the rates are, I don't know if you can, I didn't know that you could have custom rates. I think it's like the way it's like, I
Mm.
forgot what the word for it is, but each, like, say you do a shoulder surgery, you do let's say you do a rotator cuff repair surgery.
Mhm.
There's within the insurance system, there's like one rate you can charge for it, no matter where you're working, if I'm not mistaken. I could be wrong about that. Maybe most of you have some
Wow.
more knowledge on this.
There's basic like ICD-10 codes associated with specific like procedures, diagnoses, and so on and so forth. And that's how the coders
Mm.
convert the medical data into money and monetary kind of refunds and expenses to insurance companies and expenses to patients. But I mean, the physicians in reality do not hold much power. They really aren't the decision makers. Like, I just, from personal experience with like
Mm.
personal life and professional life, you know, you hear physicians, they all say like, I might have to add a diagnosis onto a chart just so I can convince insurance to, hey, this patient's sick, they need a medication.
Mhm.
Or I might have to order a different type of medication, or the not first gold standard medication, just because I know insurance won't approve that first one, but they will approve this second one, even if they're both for the same treatment. And like, there's statistics on this that really kind of, they hurt the soul a little bit. That, you know, 38% of Americans, they had delayed medical care in 2022 just due to costs. Or 30% of Americans, they skipped a prescription due to costs. Like, you imagine,
Wow.
that's probably an understatement of these numbers, that so many people, they'll either share prescriptions, or they'll be like, oh, I can't take my blood thinner medication. I've heard that, you know, firsthand. I can't take it because I can't afford it, or I don't have access to a pharmacy that provides this medication, or my insurance won't cover it. What am I supposed to do? And these are like real life situations, real human beings that are experiencing these detriments to their health due to a system that actually doesn't look at them as human beings, but rather looks at them as an average, as in a number. And as long as that average meets the standard that they want, meets the quota that they want, they could care less about the individuals that are being harmed, care less about the individuals that are suffering.
Musab, can you expand on that a little bit? What does it mean to look at your 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 population you're serving as a average rather than individuals? What exactly does that mean from a provider or from a healthcare administrator perspective?
So in terms of like healthcare systems, in a lot of hospitals, their measures of success are averages and quantifying those numbers. And on one hand, you know, metrics and quantifying is a very good thing, because that's, you know, the way that you're able to see where the deficits are and where you can improve upon things. So I'm not against kind of trying to quantify things and materialize it into numbers that you can actually improve upon and have some metrics and goals that you can reach. But their successes aren't necessarily on the patient success stories or their improvements made with patient lives or the direct impact. You know, one of the things that we have in our hospital, or in many hospitals, is something called sepsis, which is an infection in the blood. And there's a specific order set that's just an automatic order set that you click. So you don't have to choose a specific test, you don't have to choose specific medications. It just auto selects it for you.
Mm.
And you get a bonus if you meet a specific quota of using that order set, or using a chest pain order set, or using a stroke order set. And that just shows that it's really not about how many people you
Mm.
helped with sepsis, or how their mortality rates went down,
Wow.
or how they actually improved upon the actual care. It's more so you use the specific policies and procedures and guidelines that met the requirements, met the quota, so then they can get their bonus, they can get their rewards, they can get kind of the appreciation from the community or from the healthcare world and healthcare standards.
You're saying the provider is getting the bonus for that?
The physician group, they would get a bonus for it. So like, because like, at least the company that I worked with, it is a physician group, so they don't own the hospital. They bring a
Yeah.
set of providers and work in an emergency department, so they kind of handle all the physician staff at the emergency department. And if they meet, you know, a specific quota, a sepsis quota, it's like a ranking system for all the hospitals, let's say in Illinois, that we take care of. If they all meet a specific quota for like the critical care that we talked about, or these sepsis kind of blood infection order sets, or any of the other metrics that they have, they get a bonus for it. And so you have some providers, and I've seen that, they'll just, and it's annoying to them that they'll just click the sepsis order set for every single patient they see, and they'll just remove the test that they don't want because that's still considered, oh, they did sepsis order set, and they'll get 100% rate because they did it for everyone, and that's perfect for them.
Wow.
I mean, isn't that an insane incentive setup for like? Oh, how do you, as a physician? I mean, you're not as a physician. I mean, even if you might have the most moral of reasons to go into medicine, most noblest of, I see healthcare as one of the most noble professions, right? You get to literally, hopefully, their intention is to save someone's life or make someone feel better, improve their quality of life, and now you're telling me the way the incentives are set up is like you literally make more money just because of how many times you click this order set or diagnosis, right? I mean, how does that even, how have we let it get to this point where it's just about making money? Is it, whose fault is it? What do you guys think?
Yeah, to answer your question, I think that the main reason for this is you have to look at this from an ideological perspective. What is the value system that the West, the capitalistic system, actually holds in reverence, right? The main thing that we see really is how much can you get out of the working class? There's capitalists and there's working class. How much can you exploit them to literally take every nickel and dime from them in order to fill the pockets of the elite, to fill the pockets of the wealthy, the wealthy. We see privatization happening in all industries. We see healthcare, like you mentioned. We also see energy. We also see, you know, water, for example. Why is the water in the land, bottled up and resold back to us, right? These are just other examples that we can really get into.
Income. Musab, any comments on maybe why the incentives are set up this way? Why hospital systems, why their purpose is as a hospital? I mean, someone who's supposed to serve people, why is their motive, base motive to, you know, maximize profit? What do you think is behind this?
I mean, similar to what Brother Abdullah said, it's the system overall. So it's the ideology, the foundation, the creed of this system. When you look at capitalism as a ideology, it really has a specific lens of looking at everything, whether it's economy, whether it's providing food for its people, whether it's providing security, whether it's providing expanding, and so on and so forth. It has a specific lens of looking at things, and that lens is to maximize benefit or maximize profit. Anything that is profitable for them, they do. Anything that's not profitable for them, in whether it's in monetary means, economic means, social means, whatever kind of metric they want to use, they won't do. So it's really based off of benefit. And for them, they will utilize that lens and that perspective of capitalizing on everything that they do in every field they enter. And that could be, like Brother Abdullah said, in the food industry, in the economics industry, in the engineering industry, in the AI industry. They do everything with the goal of benefiting, profiting to some extent in capita or in actual intellect, in expansion, in spreading their ideology, spreading their thoughts. And I mean, it's literally insane. U.S. healthcare spending in 2023, it was $4.9 trillion in 2023. That comes out per capita about $15,000 per person in the U.S. When you think about that, that isn't going back to the people. That 4.9 trillion really isn't pulling back to the society, isn't actually benefiting society in any way, shape, or form. We still have these bankruptcies. You still have people suffering from medical debt. You still have people that are uninsured, unable to reach resources. We have, I believe, from 2010, over 160 rural hospitals were shut down. The AAMC, which the American Association of Medical Colleges, says that the estimation from here to 2036, there will be a physician shortage of up to 86,000 physicians. And that's other than the metrics for PAs, that's other than the metrics for nursing staff. It just shows that they will do anything in order to benefit the people. Their perspective isn't on taking care of the affairs of the people. That's Islam's perspective. We look at every human being as a human being to benefit them, to assist them, to support them as a human being, to get their basic needs, to get their necessities, food, water, healthcare, shelter. But capitalism and everything that comes upon capitalism goes based off of getting the maximum benefit and maximum capital that they can from any field they enter.
Yeah.
I think you touched on an interesting point. But Hudayfa, please go first. I'll
Yeah,
say my thought.
I was just thinking in my head, right? Um, you know, inshallah, I hope to be a physician one day. Musab, I know you're training to be a physician, and
Inshallah.
we know plenty of physicians and people who are in college right now who are on this path, and everyone, for the most part, if not everyone, their intention is, I want to be a doctor. As a summary statement, I want to help people. I want to do this because I see this as a very fulfilling, rewarding profession, and it is, and it very much should be. And my thought is, as we're discussing the creed of a people, of a society, will affect any anything that comes secondary to that, even if it's this noble profession of healthcare. And if you want to solve, or if you want to address this, if you want to, you can, the analogy comes right, you can chop away at the branches as much as you want, but until you uproot the the rotten tree, until you uproot the problem on a foundational level, like you're just supplying bandages, or you could just, like I said, you're just cutting away the branches, and the branches are going to grow right back. You can't you can't uh you can't fix something until on a foundational level you address what's sprouting this corruption, or what's sprouting this what I see as very completely backwards system of healthcare. I know that some countries, they maybe across the world, they might get it right. And if you look at the way their system is set up, is it's actually not a capitalist lens on viewing healthcare, because as the world has seen, as especially the American people have seen, this is not serving anyone except, as we've stated, the healthcare administrators, the elites, people. And I know we didn't discuss the pharmaceutical companies, but they've got their hand in each healthcare office. They've got their hand in each hospital administrator, whether it's very openly, or whether it's getting their getting in through the back end. So those are the thoughts that come to my mind. And Abdullah, you're going to make a comment, and then inshallah I think we can move on to a what we see as a solution to this.
No, I think you hit on a good point. I think what's missing is that ethical component, the ethical foundation, where there's an objective moral um, lens at which you view the world, where no matter what happens, you're gonna keep that level of etiquette. You're gonna keep that level of um, humanity, right? You're not gonna trade your principles for a quick buck, right? And I think that if you look at even U.S. history, a lot of the origins of the U.S. history was, you know, making treaties with the Native Americans, and then betraying those treaties, becoming traitorous, killing them, ravaging them for specific for looting them, looting their towns, looting their tribes. You even see like the one of the biggest actually um, source of income for a lot of the settlers that came to the U.S. was selling opium. Right? They came for gold. They couldn't find gold, so what did they do? They started selling opium. Right? And it didn't matter if the population around them was decaying and dying. That opium was filling their pockets. So this was something they continued. Even bringing smoking to the Native Americans. At that time, maybe smoking, the health issues weren't exactly known as much, but this was a quick buck that you could make, right? Where Islam comes, right? The lens of morality that we look at is that we're accountable. We're accountable for our actions. We're accountable for any grain, any atom of good that we do, or any atom that of bad that we do. We'll be accountable for that. And the Sharia actually serves to protect life. That's one of the components of the Sharia, to protect life, and that's something that is missing in the world today. There's really nowhere in the world where that's emphasized first and foremost.
Brother, why are you bringing religion into this?
Why? Because it's not just a religion; it's a way of life, right? The Deen is a way of life, and it's a lens at which we see the world, right? As Muslims, we're not just living here to make a quick buck, right? Maybe the kuffar are here to do that, right? But like some scholars say, if you're in, wherever you are, you have to make an effort to spread this deen, make this deen the highest, and and understanding, first and foremost, having yaqeen that this deen is the only thing that can bring mercy to the people.
Yeah, I wanted to just throw that out there. Like the
Mm,
people sometimes fail to understand or sometimes look past our this beautiful deen that we're blessed with. And deen is, it's everyone, most of us know this is. It's not just you do your ibadat. Everything is about you do your spiritual actions. You do your namaz and you do your dhikr and you do read the Quran. SubhanAllah, Allah has blessed us. Allah has blessed us
yeah,
with a way of life that is a mercy to all of mankind, not just for the Muslims, but to all of mankind. Because we've seen some of us through our own eyes, especially in this healthcare system, we've seen the depravity and the corruption and the dhulm. Really is it's zulm. It's really oppression to our people here. So the only thing that comes to mind is we possess, alhamdulillah, we possess a solution to this, and it's our role and our job and it's actually our obligation to propose this and to work towards bringing this to a reality. Brother Musab, I want to get your comments on how what is the way that Islam views health and healthcare and the livelihood of people in the realm of
Mhm.
healthcare. What's your comments on this?
I think it starts kind of on a macro scale, or kind of like taking a step back on how Islam views the human being, which we've discussed, and how Islam views a society. The goal of a ruler, or the goal of a state, is to take care of the affairs of its people, to take care of its people in every way, shape, and form, to support all of their basic needs, to support all of their healthcare needs, support all of their educational needs, all of their financial needs. Every need that they have, it supports it. So Islam views the human being, as a sacred being, as a special soul that has to take care of every single person and every single one of their needs, despite the costs, despite the difficulties, despite the obstacles. So that in and of itself shows you how Islam would view healthcare, how Islam would view how to take care of the people. When you look at the Quran and the Sunnah of Rasulullah, even what the fuqaha have said, you see how Islam has highlighted different aspects of healthcare and how that contrasts entirely with the West and how capitalism has influenced healthcare. Rasulullah said, "Ma anzalallahu da'an illa anzala lahu shifa." That Allah subhanahu wa ta'ala has not set down a disease, except that He has also set down a cure. And so when you hear that as Muslims, approaching healthcare, approaching research, understanding the biology of the human being, the anatomy of the human being, the physiology of the human being, that gives you drive that any disease you encounter, whether it's the more rare diseases, the genetic diseases, the more difficult diseases, cancers, diabetes, Alzheimer's, any type of disease, you know that there is a guaranteed cure for that, and you have to go search for that. Whereas, and that's what research should be built upon. That is the foundation of research. And I see that in an Islamic world, truly embracing Islam and implementing Islam, that is going to be the foundation of healthcare research. Because you look at every disease as an opportunity to find the shifa that Allah subhanahu wa ta'ala promised to us, that Rasulullah promised to us. Whereas right now, I look at medical students. I follow some medical students on social media that are in their third and fourth years, and they talk about their experiences applying to residency. And you realize that all of them that approach research isn't for the love of research. Every physician that approaches research during residency in these academic centers isn't because some of them might have the pure intention of trying to find a cure to some things, and that is totally fine. But the vast majority are pursuing the research field and looking at diseases and understanding the pathophysiology of diseases and where the cure is. Isn't to find a cure, it's to add something on the resume, to add a checklist that they did research, that they were involved in publications, they had something in the New England Journal of Medicine or something along those lines with, a expansive field. That is not the perspective of a Muslim. That is not the perspective of Islam. No, we look at any disease, no matter how prevalent, no matter how small or how big, and we search tirelessly, pour money and resources and effort in, because we preserve this sacred human life and we care about every single sacred human life. Whereas, I'm talking to physicians here, and one of them, I speak with him extensively about this stuff, and he tells me that there are no opportunities. They genuinely don't want to support or fund research that isn't profitable, about genetic diseases that are more rare. I have an uncle working in Jordan. He is a associate professor in microbiology. And he has done tremendous work in Jordan, creating a system that maps genetic diseases. And he was complaining, I remember, to my brother and my dad the other day, telling them that the Jordanian government, whatever it is, the systems, the embassies, they will not fund him at all to try to implement his genetic mapping and sequencing and identifying genetic disorders and trying to find cures for them in Jordan. He can't find a sponsor to help, fund it.
Wow.
Why? Because it's not profitable to cure these rare genetic disorders.
Yeah.
Hudayfa, you've done
Go ahead.
research, right?
Yeah, it's nothing. I mean, my research was a bit. It was in infectious diseases, and I don't want to go into too much detail, but I mean, the objective was always to, find a better way. What's the best treatment protocol? And alhamdulillah, it went well, and I mean, it's still going well. And one thing I'll tell you though is, if you don't have grant funding, if you don't get any funding for, if you don't, the thing that stresses out these research principal investigators, that's like the head of the lab, what stresses them out most is these grant applications. Is like, when it's time for, we need to submit this grant to get this funding from the NIH, which is like the governmental organization, I believe, that give the funding, right? And I mean, if you don't have the funding for it, I mean, forget about your research project, forget about your lab. The thing that I wanted to ask about, although, was um, pharmaceutical companies. When, just think about, just put yourself in their shoes for a second. Um, I set up a company. What's the purpose of my company? My company, usually, most of the time, if I set up a business, I'm there to make money. And take Islam out of the picture, right?
Mhm.
If I want to make a medicine for something, if I want to make a product for something, I want a returning customer. I want, I make a candy, right? Like sour candy. I just want to sell. I don't want to just sell it once and then the person never comes back. How much money? I'm gonna make $1. But now I make something that's so addicting, or person needs it. Person needs it on a monthly basis. Person needs it on a weekly basis. That's gonna drive up my profits. So I'm just putting myself in the shoes of one of these pharmaceutical company CEOs. I'm like, the way um I'm gonna make money is I'm gonna make a or I'm gonna devise a product, or I'm gonna devise a medicine, or a cure, or something that's gonna keep recurring revenue. So I'm like, yeah, if everything in terms, you want to make your money, you make your money, but when it comes to healthcare, and people's lives, and improving people's lives, and saving people's lives, like, that should be out of it. That should be out of it. And this is the way, as Musab and Abdullah, you guys mentioned earlier, is Islam views health and healthcare with a different lens. It's not money. It's not a profitable business. It's not a something that should be privatized. And I set up my healthcare uh, hospital here, and I'm gonna try to beat out my competitor there. Health should be a guarantee from the state on a societal level. And this is exactly how Islam as a system should look at it. So
I'm gonna play a devil's advocate here a little bit, if I might. So, like, are you asking for more like a communized healthcare system where, um, you could say socialized healthcare system, actually, where, like Canada, for example, where going to the doctor is pretty much free, right? But the thing is, I heard that there's very long wait times. If you break your arm, you could be in a position where you're waiting for, more than a week, to go to the doctor. Um,
I mean, I'm not gonna.
how would you combat that? I guess I'm playing devil's advocate here, but how would you
Well,
combat
yeah,
that?
no, I appreciate your pushback. I mean, one thing I hope I made clear is, me, I'm not seeking a socialist system. I have my own
Mhm,
ideology that I look at the world through that lens, and which is the ideology of Islam. It's not that, like I said earlier, it's not a mere religion. It's a way of life
mhm,
that I hold by, and I work towards its implementation. And Islam has its own way of setting up a healthcare system. It has its own way of looking at healthcare. And if you want to, compare it to the realities of the world, where it's, comparing it to socialist healthcare systems, or more capitalist healthcare systems, sure, one you can say that it might have more similarities with the socialist healthcare system. But at the end of the day, what's best for humanity? Because what we've seen in our country here today is clearly not it. And one thing I'll comment on the Canadian healthcare system is, yes, from my knowledge, I mean, I'm not going to claim to be an expert on that, but yes, there are longer wait times. But one thing I do know for sure is, um, uh, medical schools in Canada are extremely limited. Where
Mm-hmm.
I've heard it's harder to get into one of those medical schools in the Canada than it is to get into like the top institutions in America. So their problem isn't the system itself, but their problem, I think, is more on their pipeline of getting physicians out into the workforce. I don't know if Musab, you have any insight on Abdullah's question.
I mean, I have kind of two insights. One a little bit previously when you were talking about kind of putting yourself in the CEO's shoes. Kind of wanted to touch upon that a little bit. And even like completely legit, let's say they wanted to make a profit. In terms of just insulin, so comparing the US to other high income countries like Canada and the UK, the US on average, the prices for an insulin vial, one vial is about $100. That's the cost of one vial of insulin, kind of relatively. Compare that to Canada and the UK, they're between $7 and $12. So even if you wanted to make a profit, this isn't a profit. They're monopolizing, and they are it's a straight up extortion of the people and of their money. Like they could profit, you could profit all you want, but no, they don't want to just profit. They want to truly step on you, to humiliate you, to have you be subservient to them to the point that they're the only people that can provide this medication for you, and you're under their will, essentially. That's what the pharmaceutical system is doing. That's what the healthcare system is doing to people. They're not just taking capitalism, they're magnifying that. They're putting capitalism on steroids. That no, we don't want to just profit a little bit. I don't want 100% return. I don't want 200% return. I want 1,000. I want 2,000% return on my input. That's why I want my ROI to be through the roof, which is absolutely insane. But in terms of kind of the perspective that Abdullah is giving, I mean, like Hudayfa said, we don't need any other systems. Islam is, as we've mentioned, a complete way of life that highlights every single aspect, and that's including healthcare. It might not tell you exactly how healthcare should be, but it gives you the vision and the perspective on how you're supposed to implement healthcare. When Rasul I believe, or Umar al-Khattab, there was a ta'un, there was a plague going on in one of the areas. And the hadith of Rasul is, if you heard of a plague in an area, don't enter it, and the people that are there don't leave it. That's a straight up healthcare perspective, preservation within that area. That gives you the insight on how Islam deals with these things, the containment, how you should view different plagues in different instances. Allah subhanahu wa ta'ala gives us many ayats talking about the blessings in food, in honey specifically. Allah subhanahu wa ta'ala says, يَخْرُجُ مِن بُطُونِهَا شَرَابٌ مُخْتَلِفٌ أَلْوَانُهُ فِيهِ شِفَاءٌ لِلنَّاسِ. That talking about honey, that honey is a cure to the people. But when you look at research today, this is a social media kind of fad that's going on right now amongst like nutritionists and people that care about their diet and care about their health, is that research doesn't care about people's nutrition. There's no emphasis on people's nutrition, even though there's a strong connection and correlation between a gut microbiome, between your gut health, between the food that you eat and your overall health. But because it's not profitable, they don't really talk about that. Look at the vegan diets. I mean, in the beginning, the vegan diets might have started off as a really great thing, but now the companies, the food companies and corporations, they've turned it into a way to profit. Every vegan product is the most expensive thing on the planet. You'll see shelves on shelves of vegan products that shouldn't be vegan products. They just made them to make a profit off of a new way of eating or a healthier way of eating.
Yeah, you go to McDonald's and like, not saying go to McDonald's, but if you go to fast food in general, you'll see that it's a lot cheaper. Nowadays, the prices are getting pretty high as well. But there's a thing called food deserts, where um, in underprivileged areas, right, like the south side of Chicago, there's not a lot of fresh grocery stores that have affordable fresh, vegetables, meat, and all these things. So people actually have to go to these fast food places in order to just eat on a daily basis.
Yeah.
But wasn't RFK Jr. also trying to do something with the whole FDA?
This comes in the news, especially lately with I guess the new administration. But to be honest, I don't want to. I don't want to dive too deep on that because I personally don't know too much, but I know I think generally if you're proposing a healthier way of living, which is eating real food, if you're um, getting a lot of times some of the ingredients that go into our food is just crazy. I mean, just the regular thing you have in your pantry. The amount of high fructose corn syrup. That's something that shouldn't be in our diet. That's something that really drives your addiction to these foods. I mean, I was thinking, why is there this much sugar in ketchup? Ketchup's supposed to be tomatoes. Okay, why is there so much sugar in my freaking ketchup? So I mean, at the end of the day, something that's gonna drive you to eating more. At the end of the day, if you look, we're talking about is your ideology gives rise to these way of living, and the way the companies are set up and the way they're gonna be marketing their products and they're gonna be developing their products. So if you're gonna have a returning customer to your more addictive ketchup, that's what you're gonna make, right? Um, the last thing I want to bring our podcast to a close with is, someone might say, my someone from a capitalist perspective might say, hey, our way of life or our nizam, our system, our region of the world has driven more innovation than any others. One, is this true? And two, um as if someone might say, look at the Islamic world today. What have they done? What would you guys say to that? Anyone
And
can say this.
I would tell them just look at history. You really think all of this healthcare and all these advancements actually came from the West? The majority of our healthcare as we know it, science as we know it, mathematics as we know it, arithmetic, all of that, even like the evolution in the food industry, like the idea of a three-course meal, all of these advancements happened in the Muslim world during the golden age of Islam, the advancements, by people like Ibn Sina. You see that they're the people, they're the true fathers of medicine. They are the ones that invented all of these surgical tools and technology. They're the ones that really understood the human body. They're the ones that understood math and physics and science and biology and really implemented that and applied it on, taking care of the people. That's where all of the innovation and advancements came, not from the West, because Islam pushes people towards doing things and pushes the Muslim ummah towards doing things that will benefit the Muslim ummah. I believe it's a hadith by Rasulullah that says, "Ahabbu an-nas ila Allah anfa'uhum lin-nas." It's either a hadith or an ayah, but the best of people to Allah subhanahu wa ta'ala are the people that benefit people the most. That is our perspective. That is our foundation of our Muslim mindset. And that is why you see during the Golden Age of Islam that we have advancements. We're always at the top of our class, the top of our professions, the top of our fields, because we want to benefit the people the most. We want to ammar this world. We want to evolve and innovate and improve upon this world and provide for this world and provide for this ummah as much as possible. That's the Muslim mindset. We're constantly working and trying to benefit and trying to improve and develop. The West, they're really just leeches trying to take from the people. That's their mindset.
Yeah, I think it's a good point on incentive. I mean, every human's gonna have some sort of incentive they're gonna work towards, right? And whether it's money, or for us as Muslim, it's al Jannah, and it's al Firdaus and the highest level of Jannah, inshallah, right? And the truly, if someone who really understand that is gonna be is so much more motivated than just seeking, as you guys said, is seeking a quick buck. That's the way incentives are set up here. Abdullah, any comments on that last part of the question? On someone might say, hey, look at the Islamic world, what have you guys contributed to the world?
Yeah, I think some people like to conflate, like to say that, look, this was just a coincidence that they say the Arab civilization, they leave Islam out of it, right? Some Orientalists, right? They like to leave Islam, but actually, it was Islam was the reason why all these advancements actually occurred, like the hadith the brother Musaab mentioned before, right? That encourages us to help others, and the ayat in the Quran that mentions, saving one innocent life is like saving all of humanity, and killing one innocent life is like killing all of humanity. And there's plenty of other examples of that within our text, within the Quran, within the Sunnah. A
Mhm.
lot of people think that Islam, once on a societal level, it's just gonna bring us to the Stone Age, and it's just gonna be some violence. People are gonna start attacking each other. That maybe they don't believe that, they're gonna start attacking one another for sectarian reasons or all these other things. But if you look at how Brother Musab mentioned, like the golden age was under Islam, where under the Khalifa Harun Rashid, he was the one that really helped advance medical sciences, translate a lot of things from the Greeks, built a lot of hospitals, and also traveling clinics. I know you guys probably do research in your studies where you guys see how in rural areas in the U.S. a lot of people are not getting the medical treatment they need. But look at, during that Islamic golden age, they had traveling clinics to help people in these underserved areas, right? So I think we have to reconnect with our history, number one, and number two, we have to understand that the paradigm at which um, the West looks at things, while to go back to your question, there is innovation, but innovation is always tied to profit. If it's profitable, then there's going to be innovation. And like you guys mentioned during research, some researchers are not given any grants, right? They're not given the funding they need. Um, and why is that? Well, a lot of times, if there's not profit seen um, at the end of the day, then there's not worth pursuing. But we don't see profit. We see how will this benefit society? How will this be in a scale of good deeds on Yom Al Qiyamah for us, inshallah.
Inshallah. Jazakallah khair, brother Abdullah. I want to bring this to a close, and inshallah maybe set up a part two, because one of the things that someone, I don't know who mentioned the food deserts, and people seeking out fast food, and not having the almost sometimes even the will to care for yourself. Why do you see obesity such maybe I think
Yeah.
America is one of the highest rates of obesity, right? What brings a person to eat themselves to death, literally? That's one of the greatest predictors of mortality, right? Um and and uh, I think there's discussion in media when you hear about these mass shootings and school shootings, especially. The topic always comes, is mental health and people caring for the mental health. And truly, I believe that you literally, there's no such thing as well, I mean, maybe I'm wrong about this, but you can't solve mental health without having Islam, without having Islam in your heart, because Allah says in the Quran, right? Your hearts won't find rest until you remember Allah, until the remembrance of Allah. So inshallah, I want to set up if Musab is ever down for it, a part
Mhm.
two where we discuss this topic more in depth. And any last comments, brothers, on this topic of healthcare system and how Islam really is the solution to the healthcare crisis we see today?
I think with just like a message to people that are trying to pursue towards change or pursue towards whether it's improving healthcare or engineering or anything to benefit this ummah, to benefit the world, to benefit mankind, it always reminds me of the ayah of Allah subhanahu wa ta'ala where he says, وَمَن يَتَّقِ اللَّهِ يَجْعَلْ لَهُ مَخْرَجًا وَيَرْزُقْهُ مِنْ حَيْثُ لَا يَحْتَسِبُ. So whoever has taqwa of Allah subhanahu wa ta'ala, he will find an exit. He will find a means for him. He will give him rizq, for pursuing that path for the sake of Allah subhanahu wa ta'ala, having taqwa of Allah subhanahu wa ta'ala. And so for us that are seeing all these difficulties, I know like a lot of negativity might have been portrayed, throughout our
Hmm.
talk with,
Hmm.
a lot of obstacles, someone that's trying to pursue healthcare, trying to pursue being a physician, it's like, oh, this is just a daunting task. I'm never going to be able to benefit people. I can't work. There's no independence of being able to work and helping the world. And reality is that's not true. You can actually, try to step by step perform the actions that need to be performed, try to implement the Islamic perspective on healthcare, and trying to implement the Islamic viewpoint on various matters within your community and within the society, and inshallah within the world. May Allah subhanahu wa ta'ala kind of grant us
Inshallah.
that victory and grant us that opportunity and that izz and glory
Ameen.
for Islam. But trying to pursue upon this path, always remember that our marji' or our foundation is Islam, and everything we do is for the sake of Allah subhanahu wa ta'ala. So we need to look at things in that correct lens.
Jazakallah khair, brother Musa. Yeah, I think very well said. Everything
Mhm.
truly, it starts with the intention, and as long as the intention is to seek the pleasure of Allah, He will make ways for you. I think with that being said, let's bring this to a close.
Beautiful, man.
Jazakallah khair, brother Musa, for being generous with your
Jazakallah.
time. appreciate your insight. I thought it was very nice how you had the statistics lined up with you. I thought they were very insightful to our discussion. I think your perspective you offered was great, alhamdulillah. And jazakallah khair to our viewers for tuning in. Let us know in the comments if there's any more insights from you guys, if there's anything we missed, anything else you want to hear about. With that being said, jazakallah khair wa akhiru da'wana alhamdulillah rabbil alameen. Assalamu alaikum wa rahmatullahi wa barakatuh.